Good afternoon, everybody. Thank you, Nitin, for giving me this opportunity to be a part of an excellent debate. I'm going to talk on comparing newer technologies, the Relax Smile versus Femtolasic. Essentially, I'm going to talk about Smile because Relax is behind Smile. No financial interest, acknowledgement, people back home who help us in making presentations. So, previous speaker, Dr. Sujata Mohan, has already made the life simpler for me. Femtolasic, also called as bloodless LASIK, it has been there for more than a decade and it is very well established. Millions of surgeries performed. It has got a very small learning curve nowadays. Initially, probably it was more. Results are definitely shown to be superior to microkeratome LASIK in terms of planar flap, higher order abrasions, etc. Safer. Complication arguably lowest ever. And so, under these circumstances, is there a need to improve and at what cost? Some of the key benefits of bloodless LASIK are you get a locked-in flap, and nowadays we don't score while removing the flap. Because of that, the incidence of epithelial hyperplasia is less and the ring is seen much less post-operatively. It is a fully sterile procedure, tight control over the flap thickness as all the speakers have said. You can do thin flaps and planar flap, of course, which give you better apposition and mud cracks are less. Nowadays, this is a video of a Lensix flap maker. There is no scoring required. You can straightway go in, which causes less incidence of epithelial hyperplasia, as I already mentioned. And the flap lifting is very, very simple. At this point of time, the laser is taking more time as compared to other lasers like FS200 and Interlace, but the flap quality is very good, very tight control, and look at the quality of the blade. The quality of the flap, the bed. It's really great, and that's why you feel really happy about for the patients. Now we talk about Smile. Relax is, of course, it precedes Smile, so we'll talk only about Smile. It definitely has some advantage like 3 to 5 millimeter incision, theoretically superior, some definite advantages. But is it really worth? Let's see. Does it cover the full range of patients? No. For small refractive errors, 0.75, somebody wants to go to merchant navy, very difficult to do Smile. Hyperopia, you can't have a negative meniscus removed from the pocket. Then custom LASIK, of course, custom LASIK is an important thing for us. Pure cylinder can't be done. C3R and PRK treatments like that are also not possible with Smile. Custom LASIK. Now, wavefront guided LASIK is definitely essential for 5 to 10% of the patient. Rather than reading the higher order abrasion chart, let's go just ask the patient how much difficulty he is having while driving at night. If the answer is yes, of course this is very simplified, you go ahead with wavefront optimized LASIK. Then topo guided LASIK is also important for retreatments, decentered ablation, small optical zone, prior RK patients, and hypermetropes. Hypermetrope because it takes care of the angle kappa, which cannot be taken care by Smile. And Contura. Contura is a new topo-guided LASIK which is coming into vogue, and it is for primary eye treatment and refractive error. So all these things are not possible with Relax laser. And retreatment cannot be done by creating a pocket. It has to be done by excimer laser only. There are incidences that retreatment done on Smile, there is increased incidence of haze. That means once you do PRK on Smile, there is increased incidence of haze. Then capital investment. It's a huge, most expensive machine today, and the consumables also most expensive. And CMC, AMC, all these three, it scores much higher as compared to normal excimer laser and femto. And all this has to be, while considering the cost, don't consider only for the Smile, but consider cost of excimer laser also, because we have to do lot of cases which cannot be done by Relax Smile. Then we are buying additional set of complications, incomplete lenticular removal, rat tailing, and the visual recovery is slow. Of course, it is improving now, but there are incidences that visual recovery is definitely slow. One of the new study which is published in one of the peer-reviewed literature, it says that smile and normal flap, there is no difference in the corneal strength of the residual bed. So it's not helping us there also. So it's everybody's choice. Our next speaker will talk about smile. Thank you very much.